of us know now. You walk by the mirror and go, oh, that's my mom. How did that happen? Facelift is what we think of for that, yes?
Correct.
So let's take a look at a before. This is a woman who comes into you for a facelift because?
Well, she just said that she looked tired all the time. She'd go to work, she's a nurse, and she just felt that she looked tired all the time, and even though she wasn't and energetic. And so when you look at her, her brows are drooping, her cheeks are drooping, and I was lecturing in Athens, Greece on endoscopic facelift surgery because I was one of the pioneers in that type of surgery. And that's a surgery where incisions are tiny, recovery is very quick, and you can do a lot of things through the TV camera.
And is that what she had?
That is correct.
So let's look at her after. Quite a difference.
Oh,
Quite
yes.
a difference.
And it affects her every day. She wakes up, she's happy, she's very energetic. She's diabetic, and diabetics don't heal that well, but when you use this type of surgery, they do extremely well.
So what would have been her recovery time?
A lot of patients go back to work in about 7 to 10 days after this type of surgery.
Now, let's look at a rhinoplasty or a nose job. This would be the category where, hey, I just don't like my nose. You said floppy ears, other things. And this is a young person.
Right, so picture this person in school, a different patient of mine that I operated on not too long ago, a young male. Kids at school would call him the vacuum cleaner because of his nose. And every single day he comes home and his parents tell me that he's in tears. And so if you can do something to change their face to a normal face, it makes a big difference in their lives.
All right, let's look at her after.
Here she is a month later. And I remember when she came in about 10 days after surgery, and I took her splint off her nose, and the first thing she did was she went out with her friends that evening because she was so happy.
And her recovery time would have been?
Well, what I've done is I've taken all these surgeries. In New York, I was trained to do these very large invasive surgeries, and now what I describe it is the finesse technique, where bleeding is very minimal, discomfort is very minimal, a lot of patients don't take pain medication, recovery is unbelievably quick compared to the more traditional techniques.
Which might lead us into the mommy makeover. Giving birth to a child is very painful. And then you have a specialty, and you call it the mommy makeover.
That's correct.
And it involves both the tummy tuck and breast augmentation?
That's correct.
So we're going to look at a woman who was 38 when she had her third pregnancy.
That's correct. She's 38 in this picture, and she's 8 months pregnant. And then in the follow-up picture, she's 45, and the little boy standing next to her, is actually in her tummy on the first picture.
Well, as you know, there is controversy regarding the prevalence of cosmetic surgery. Not everyone feels that this is the proper thing to do to alter our bodies in this manner. What do you say about that?
Well, it's not for everyone. It's for people who have a good reason for wanting surgery. It's surgery, and it's elective surgery. Those people who are very happy with how they look, obviously you wouldn't want to do anything to them. Usually the patients have thought long and hard about it. They've thought many, many years, so it's not something that they take lightly.
Does it suggest, though, that our culture has too much of an emphasis on vanity?
If you shower routinely, if you wear clean clothes, if you manicure and do your hair from time to time, that's vanity. You want to look good, you want to feel good. Because of the advances in surgery and in the techniques, and like the surgery nowadays is not what it was 20 years ago. I think a lot of people are saying, well, if I can do something for me that will affect me every day from morning to night and make me feel good, then why not?
So if the world were perfect, how we looked would not affect how other people see us or how our self-esteem is developed. You clearly believe that it's fine to alter a child or a young person's appearance in order to help their self-esteem.
Well, when I deal with children, I always deal with the child. I talk to the child, not to the parents, and I want to know what their attitude is. I had a young girl, she's 9 years old, and she was born with the lower third of her ear disconnected from her face. She wore long hair, didn't bother her, but suddenly she's getting at the age where